This video will help the beginning student learn how to perform a physical assessment. Pay attention not only to the techniques that the nurse uses, but also to how the nurse gains the patient's cooperation. Note how she instructs and educates the patient throughout the exam, and how she keeps the patient focused on the task at hand. Watch how the nurse uses humor, sincerity, and an underlying caring attitude to gain the patient's trust and establish a relationship. The bedside nursing assessment should be performed at the beginning of the shift in order for the nurse to obtain a baseline of the patient's status. It will also validate information that was given in the report and may identify new patient needs. The assessment also evaluates the normal expected progress of a patient to the patient regime. The nurse should perform hand hygiene, identify the patient, provide privacy, and explain what she is about to do. As the nurse enters the room, she should assess the condition of the room, monitors, and the patient to determine if anything is abnormal or needs attention.
Mr. Burrows? Mr. Burrows? Good morning.
Where am I?
You're in the hospital. Do you remember that?
Oh? Oh, yeah. My stomach.
Yeah, that's right. Let me go ahead and set you up a little bit, okay? My name's Rachel. I'm going to be your day nurse today. Can you tell me your name?
Assess the patient's level of consciousness. The patient should be easily aroused and oriented to person, place, time, and event. Any new change in the level of consciousness could be indicative of a neurologic or cardiovascular problem or medication side effect. Performing an assessment on a patient with dementia or a decreased level of consciousness may be more difficult since he may not be able to answer questions or follow commands. If the patient is disoriented or confused about something, reorient and explain as needed. If there are any new findings, they should be reported unless there is a known cause. Specific questioning can be omitted if it is apparent through casual dialogue that the patient is alert and oriented.
Joe.
Okay. And your last name and date of birth, please.
The problem's down here, Missy, not up here.
I understand that. How about that name?
Mickey Mouse? I didn't know you'd have a celebrity today, did you?
I did not.
Joseph R. Burroughs, Jr., born December 3rd, 1922 in Chicago, Illinois.
Very good. And the month we're in?
It's Turkey Month.
That's right. Are you excited about your holiday?
Turkey's the only good part of November. The rest is just cold.
I agree with that. I need to do a quick physical assessment, listening to your heart and your lungs and a few other things just to see how you're doing, okay?
You woke me up for that?
I'm sorry, but it is important.
Before starting the assessment, make sure that the patient does not have any immediate needs. Primarily evaluate his vital signs and assess his pain level. Medicate for pain prior to the assessment if needed. If the patient's vital signs are abnormal or if he is in pain, the patient may not be able to tolerate a complete head-to-toe assessment at this time and may need immediate attention to a problem.
How'd you sleep last night? You look a little tired this morning.
On this rickety old thing, my wife got us a Serta at home. That there's a bed.
Did you have any pain throughout the night that kept you from sleeping?
Yes.
Okay. How about now?
Yes, but only when I move.
Okay. On a scale of 0 to 10, 10 being the worst pain you can imagine, how bad is the pain when you move?
Maybe a 2.
Okay. And what does it feel like?
Sharp, like a pin.
Okay. All right. Did the medicine that night nurse gave you help at all with the pain?
As what I can remember, yes. Do you think I can get some more?
You can have some more in about an hour, but I'll need to come back and reassess your pain before I give you anything. Making sure you get adequate pain relief is one of our priorities for today, okay? So I think I can go ahead and do my physical assessment now if I promise not to move you too much. Okay, I'm going to start with your eyes. All right. Now, as I flash the light into your eyes, I need you to look into mine.
Check the eyes for pupil size in response to light. First, note the size of the pupils without any light. Then flash the light into the left eye coming from the side of the patient. Check the response to the light in the left eye by noting how much the pupil decreases in size and also how quickly it responds to the light. Flash the light again into the left eye, but this time note how the right pupil responds. Normally, the response should be the same in both eyes. This is called a consensual response. Check each eye in this manner. If the pupils are equal in size and react briskly to light, this is described as pearl.
Okay. Okay, very good. Now, I need you to look at the end of the pen light and follow it with your eyes.
Next, check the eyes for accommodation. Do this by having the patient stare at the pen light with the light off. Start with the pen light about 8 inches away from the patient's eyes. Instruct the patient to stare at the pen light as you take it further away from the patient about 20 inches and then bring it closer again to the patient's eyes. Keep your eyes on the patient's eyes as you do this maneuver. The pupils should dilate as you take it further away and constrict as you bring it closer to the patient. Check the ears for any drainage, redness, or lesions. If the patient has a nasal cannula, make sure that it is not irritating and breaking down the skin around the ear. Check each nostril for redness, patency, discharge, and crustiness. Lastly, check the mouth for color, moisture, lesions, and the condition of the teeth and mucosa.
Joe, I actually need you to follow the pen light with your eyes.
You look just like a very young Angela Lansbury.
Angela Lansbury? I've never gotten that one before. Okay, now let me check the cannula. Sometimes it can dry out your nose just a little bit. Okay. Does it bother you?
No.
Okay. All right, how about behind your ears? Let me check there. Does that hurt at all?
No.
Okay, now this way. Okay, very good. All right. Can you open your mouth for me? Alrighty. Looks pink and moist as it should. Okay. Now I'm going to listen to your lungs.
First, assess the patient's breathing rate and pattern. Note if he is having any difficulty breathing, such as the presence of retractions, or if the respiratory rate is increased. Note any pallor or cyanosis that may also indicate a cardiac or respiratory problem. If the brain is not getting enough oxygen due to a respiratory or cardiac issue, the patient may have an altered level of consciousness. If the patient has a pulse oximetry, check the value.
Really easy. Okay. There you go.
Next, with the diaphragm side of the stethoscope, listen to the breath sounds. Give clear directions to the patient on how to breathe. It is important that the nurse listen to the entire inspiration and expiration of each breath, since some adventitious sounds may be heard only at the end of the expiration. Besides listening for adventitious sounds, it is also important to compare the amount of air that moves in and out of each corresponding part of the right and left lungs. Remember that there are 3 lung lobes on the right and 2 on the left. This same pattern is repeated on the back.
I need you to take a deep breath with your mouth open every time I move the stethoscope across your chest, okay? Okay. Now, just breathe normal while I listen to your heart.
You listen to the heart to ascertain rate, rhythm, and presence of a murmur. Listen to S1 and S2. Do you hear any swishing sounds that may indicate a murmur? Do you hear any extra heart sounds or clicks? Is the rhythm regular or irregular? If the patient condition warrants it, you may choose to listen to the heart in the 5 areas on the chest that correspond with the heart valves.
How's it ticking?
Well, your heart sounds good, but your lungs are really diminished. That's normal after surgery with anesthesia. It just means you're not moving enough air in and out of the bottom part of your lungs. Okay, that's kind of normal though when you're not moving a lot in bed or taking deep breaths. Have you been using your incentive spirometer?
You mean that torture machine?
I'll come back later and I'll show you how to use it so it doesn't hurt so much. It's really important though, it helps prevent pneumonia. Now for the main thing here.
The sequence of the abdominal exam is to inspect, auscultate, percuss, and then palpate. In most hospital settings, nurses do not percuss. Start by looking at the abdomen in all 4 quadrants. Is it distended? Scaphoid? Do you see any pulsations or any protrusions indicating a hernia? Are there any scars, tubes, or dressings in place? Next, listen to the abdomen with the stethoscope starting in the right lower quadrant. Gurgling noises should be heard in all 4 quadrants. Note if the bowel sounds are hypo or hyperactive. Next, palpate the entire abdomen, remembering which organs are in each quadrant. Note if there is any tenderness, masses, or pulsations. Also note if the abdomen is soft, firm, or rigid to touch. Now is a good time to inquire about any bowel movements or any dysuria.
Okay. Well, your dressing is clean and dry, which is good. Your abdomen is a little distended.
Okay, give it to me straight. No sugarcoating.
Shh. Let me listen just for a minute.
Okay.
Joe, I know you're anxious and worried, but what I see and what I hear is pretty normal for after surgery. Your abdomen is a little bloated, but it's soft, which is typical. Let's see. How about any gas? Have you been passing any?
Silent but deadly.
Okay. Well, that's good. That means everything's starting to go back to normal again. You'll start to pass more and more pretty soon, at which time your belly will go back down to a normal size, and you should be able to have a bowel movement. When was your last BM?
You mean poop? A couple of days before surgery. How about we get that started again with a good steak?
How about we try some clear liquids first to see how you tolerate them?
Oh. But only strawberry.
Gotcha. All right. Now I need to look at your arms.
When examining the upper and lower extremities, you are assessing the musculoskeletal, cardiovascular, and neurologic systems. It is important to compare the right to the left for symmetry. Besides any IV lines or monitoring systems, there are 5 things to check in each extremity. Check circulation by palpating right and left pulses simultaneously. Check the quality of the pulse. Is it equal in both extremities? Is it weak, normal, or bounding? This is usually graded on a 1 to 4 scale, with 1 being weak and 4 being bounding. What is the temperature of the extremity? You may need to compare this to other parts of the body. Check the capillary refill in the nail bed or finger and toe of each extremity. It should normally blanch and then refill to a pink color within 3 seconds. Then check the extremity for the presence of edema. To check the neuro and musculoskeletal systems, have the patient grip your fingers. Check the strength bilaterally. Repeat this with the feet, having the patient push and pull against your hands.
Let's put them right up here. Okay. And check your arms and your hands. pulses are very strong. Your hands are warm. Okay. All right. Very good.
Hey, I didn't do it.
You have got a funny bone this morning. Just squeeze my fingers. There you go. Wow, that's very good. Okay. All right, you can let go now. Let me just look at your IV. Okay, does it hurt?
No.
Okay, the site looks good. All right. Once you're starting taking fluids again, we'll be able to take all this tubing and the bag down and just leave the catheter in. All right, now I need to look at your legs. All right. Okay. Good pulses. Okay. Very good. Okay, now I need you to push against me like you're pushing down on a gas pedal. Okay, very good. Now, bring your toes up toward your head. Okay, very good. Now, let me check to see if you have any edema. Okay. Very good. One last thing, I need to look at the skin on your back, okay? And I need to listen to your lungs, so I'm gonna help you turn. Will be really easy. There you go. Take deep breaths. Deep breaths. There you go. Very good. Okay. Now I just need you to breathe the same way you did when I listened to your front.
Examination of the skin should be performed throughout the entire assessment as you review the body system. When listening to the breath sounds on the back, it is an excellent time to look at the large body surface, especially the coccyx area, the heels, and any other bony prominences that can be viewed from this angle. Check for redness and any other signs of skin breakdown.
Okay. All right. Now just let me check your skin. Okay. All right. And we'll check your bottom as soon as we get you up to give you a bath for the day. All right. Okay, now very easy. Let's come back. There you go. There you go. All right. All right. Mr. Burrows, it looks like you're on your way to recovering just fine.
Rachel, it's been a pleasure. You will be coming back, won't you?
Oh, I'll be back. I'm going to help you with that incentive spirometer.
Oh.
And I'm going to bring you some strawberry jello.
Since most head-to-toe assessments are started at the beginning of the shift, as you finish the exam, it is always a good idea to answer any questions the patient may have and to describe the plan for the day. Before you leave the room, take one final glance to make sure that all monitors are running as ordered, that the patient is comfortable, that all supplies that the patient may need are close at hand, and that the environment is safe with the bed in the low position.
Is there anything else I can do for you while I'm here?
Hey, how about a cigar and a back rub?
You are going to be trouble today. I can already tell. Here's your call light. All right. Let me lower you back down. I'll see you soon, Joe.